Election observers on the auspices of Progressive Group for Democracy have called on President Bola Tinubu and the Attorney General of the Federation to reject planned tenure elongation of local government administrators. The Observer Group made the call during a briefing in Abuja on alleged extension of local government administrators in Lagos.
Firstly, President Tinubu must publicly reject the third-time agenda in Lagos Local Council, and the Attorney General of the Federation must issue an immediately advisory on term for local government administration. Secondly, LASI must qualify all candidates seeking an unconstitutional third time. Thirdly, those individuals in Agbado, Okeodo, and Ikosi Isheri SCDA must withdraw their candidates immediately. We are not making requests. We are starting what the Constitution already mandates. Lagos State Independent Electoral Commission must equally demonstrate true independence by immediately disqualify all candidates seeking an unconstitutional third time.
The group threatened legal actions against any attention to extend tenure of local government administrators, which they say is unconstitutional. Moving on, the coordinating Minister of Health and Social Welfare, Professor Mohammed Alipate, says the federal government, under the leadership of President Bola Tinubu, has put in strategic policies and an enabling environment to accelerate private sector growth in Nigeria's healthcare industry. Professor Pate made the remarks on Tuesday in Abuja while receiving a delegation from the European Union Commission and the European Investment Bank, EIB, led by Dr. Abdul Mukhtar, the National Coordinator and Presidential Initiative on Unlocking the Healthcare Value Chain, PVAC. The minister emphasized that the President's administration value is its partnership with the European Union, particularly in advancing initiatives aimed at unlocking the healthcare value chain. He noted that PVAC plays a crucial role in leveraging both public sector expertise and private sector innovation to drive sustainable progress in the health sector.
So that on the policy side, we do what we need to do. On the regulatory side, we do what we need to do, but enable the private sector to thrive. It's a very opportune time for the collaboration. As Nigeria is transforming its health system on the public side, the value chain is an important element of it. Of course, the public investment, primary healthcare, sexual reproductive health, other investments are ongoing. And I think we've had that conversation with the Commission and the investments that you have been making. But on the private sector side, I think PVAC has been moving along quite nicely.
During the visit, Dr. Mukhtar briefed the minister on the promising opportunities that Nigeria's collaboration with the EIB and European Commission could bring to the healthcare system.
We forged the relationship with Bank of Industry, and we'll be talking to Bank of Industry like almost on a daily basis, and they actually, the EIB has identified now a number of potential deals that they are willing to support. I think we're looking at about 3 potential companies: HMA, Medical, I think the vaccine company, Aprivax, and then Synergen Pharmaceuticals. But there are also other deals that they are looking for. One of the things that we also discussed with the delegation is the possibility of creating a vehicle, like a fund-like structure.
And we heard this call from our African partners saying, okay, we want to manufacture more at local level, which was exactly the agenda we were looking to move towards our support to our partner country, more private sector driven. And we said, yes, we want to partner with you and to support you to do this. Both, of course, to create the value chain, to create jobs, to create the capacity for the country, but also to create the EU, African and Nigeria partnership at private sector level. So